The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome to Meet the Doctor. My guest today is Majid Jamali. He's an OMS, which is an oral and maxillofacial surgeon here in New York City, in Lower Manhattan specifically. Welcome to the podcast.
Thank you very much. Thanks for having me.
It's nice to see you today. It's a beautiful Saturday, and we're inside talking about you.
Oh, boy.
Yeah. The best place to start is usually just tell us about yourself.
Okay. It's a long story, but...
we have time.
Where do I start? I'm from Iran originally. I was born there and raised until 14. But due to war with a neighboring country, had to fled the country and came to Europe, tried to get visa to US for a few months and finally made it to US, 1986. And so it was the middle of high school. So I did the high school in Massachusetts, along with college and dental school in Tufts University. Then I worked actually as a general dentist for a year, then did a year of dental anesthesiology in New Jersey, and went back to general dentistry because I couldn't afford going to a specialty and didn't have a green card. And of course, unfortunately, 9/11 happened and they stopped all the immigration process and delayed things. So I actually became a citizen after 25 years of being here.
What year did you do that?
It was 2010.
Wow, you really fought.
Yes, and it was tough. But yeah, so I came back. I was actually in La Jolla for 8-9 years doing general dentistry. That was nice.
Really?
Yes, but I wanted to further my education. I didn't think that was enough for me. So
yeah, well, the weather and the environment in La Jolla is really awful. So I can see why you left.
Yeah, wearing t-shirt every day and convertible in front of ocean. It got to me. So I had to come to Kings County Hospital, middle of Brooklyn, and hear gunshots while I'm on call. And
oh my gosh.
So I did that in 2005. I returned to New York and spent 5 years in downstate and Kings County Hospital, completing maxillofacial surgery residency, and then went to Lenox Hill Hospital and completed a year of fellowship in orthodontic and jaw surgery. And after that, I started my own practice in Lower Manhattan, and here I am.
That is a long road.
Yes. Changed high school 4 times. Sorry.
Let's go back to high school for a second.
No, please don't.
Yeah. You said you were 14 when you fled Iran, so that must have been with your parents.
No parents.
No parents?
No
you
parents.
did this alone?
Yes. So parents stayed back because I had siblings there, older. So basically when you're 14 and a half, the government would keep you until you're 17 or 18, whatever, you finish the high school. And you would pass this rigorous exam. If you got good grades in the exam, you would go study in university. And if not, you go to army, which meant war. And back then, and still is, really the mullahs, supporters or government people would go to medical and dental and higher education. So the other people wouldn't. So yeah, that was the story. You would go to war, basically. And
so you're seeing this deadline approach.
Yes.
And you're 14. And so your parents were supportive of you leaving.
Well, I didn't know. This 14-year-old doesn't know anything. I still don't know. But my parents do you let your kid go or have him go to war? So which one is it?
These are terrible choices.
Terrible choices. And many people like me had to do it. Most of my friends did this. So there's like a generation of boys that came at the age of 14, 15, whether with their parents and mostly with their parents, but a lot alone. So
when you meet someone else from Iran who's here in the United States and is about your age, do you sort of have an understanding of why?
Yes, absolutely. Right. Yeah, we went through a lot. But a lot of people went through a lot, all the immigrants mostly.
Looking back on this sort of beginning of the second part of your life at such a young age, do you feel like everything after that was not as hard? Did it set you up to be bolder and take more risks?
I think in general, I'm an ambitious person and kind of bold, take a lot of risks, sometimes too many risks, including opening an office in La Jolla without green card or money.
No.
I mean, they almost kicked me out of dental school because I didn't have money. So one day the dean came, tapped on my shoulder and like, can I see you outside? So you got to pay by in a month, $20,000, otherwise you're out. And I couldn't get a loan because I didn't have a green card. So I kind of lied and I said, yeah, the money's coming. So finally shopping around, I got like a 13% interest loan and ended dental school. So did I get tougher? I'm not sure. And same, probably. Not being a citizen and not having a green card, it was the toughest. And it's like every year is the same because there's so many issues that others don't see even. Like if you want to go to, for example, Bermuda, you just get on a plane and go. But as an Iranian, you have to go to embassy, apply for visa, buy your ticket first, and get medical insurance, and then get your visa. So it's a lot of things like this that you have to go through. But so that was the toughest part, yeah. Getting loans, getting just through the life. And also after 9/11, I mean, immigration would have us report to immigration in Los Angeles every month. So I would close my office once a month. I would go in a room and report what I've been doing, where I've been, and what I'm doing. And in fact, a lot of professionals got arrested, Iranians, just for no reason. At that time, if you remember, it was rough. So, yeah.
I do remember hearing about it in the news, and certainly there was outrage, but I've never met anyone who actually had to do it.
Yes. I mean, it was scary times because as Iranian, I mean, people, there was no prejudice. They would attack at that time, if you remember, like people would get attacked in taxi. And I was afraid. My parents visited me and I was really, truly afraid for them. I mean, it was dangerous times.
So your parents are still living in Iran?
They're living in Iran, yes. They come every 2-3 years, but they're older, 90 years old. So
they're 90?
Almost, yeah.
So will they still come visit?
They were here last year, so they do, yeah.
Oh, that's remarkable.
They're healthy. I got good genes.
You are a person who has solved incredible problems just to keep on the track you're on and to get where you are. And I think there are many parallels that could be drawn to the kinds of patients you see, especially if they've been through something traumatic or something difficult, And I have always had maybe the most respect for OMS surgeons because you're able to take apart someone's face and put it back together, the whole face, like the entire thing, the inside and the outside. So am I accurate here in my assessment of?
Yes, it's a nice field because, and it has such a huge range. I mean, and OMS can stay in the office and do wisdom teeth all day if they want to, or do frontal sinus by pull out the skin of the face down and repair the fractures around the orbit and nose, and work with neurosurgeon around the brain and do tumors, malignancies, do head and neck surgeries, facial plastics if they want to. So it's a unique specialty. And also I believe we're the only specialty in the country that we can do IV sedations in the office ourselves. No other specialty can do that.
I never knew that.
Yes, even plastic surgeons or anybody else. Because we do get training 6 months to a year in anesthesia in the program, and we do pediatric anesthesia. So we do it all. So yeah, it's nice. And of course, face anatomy I think, is the most interesting anatomy in the body. So
I've heard
a lot
that.
involved. Yes.
Today, you're several decades into this career, and it's clear that you can do it all. But what are you focused on in your current practice?
Well, I don't do, and I'm not trained to do malignancies. You really have to do a year or two extra to do head and neck malignancies. I do benign tumors, but those I don't. Facial plastics, I have a knowledge of it, but I don't get into it because when I'm doing something, I really like to be an expert in it. My patients are not guinea pigs, so I really want to know exactly what I'm doing. So my passion has been always orthodontic surgery, jaw surgery, and my mentor was from South Africa, one of the best surgeons in the world, Dr. Reneke, and I visited him a few times just to grab every piece of knowledge that I can from him. And so that has been really a passion of mine. It just changes lives and gives so much confidence to a patient. Even with a minor chin surgery, it just makes a huge difference. And it affects the whole face, actually. The nose and ears and eyes just all go into balance when you do mid-face and lower face. And the other stuff that I'm really recently have become passionate is minor surgeries like gingival or gum grafting, and we call it plastic surgery for gums. So that has exploded last 2-3 years, and I enjoy that. And gingival work, gum work around the implants, dental implants, and bone grafting, ridge grafting to help people to have implants again, which 10 years ago, 15 years ago was impossible. So these days we can do anything really, and anyone can have a dental implant. So yeah, I've had good teachers, and I continue to strive to learn more about those things.
In the general sense, all of this is cosmetic, right? We don't want to look disfigured or deformed.
Well, cosmetic, and also for jaw surgeries, really, some people may have an overbite, underbite that really cannot function.
Right.
So my patients are half-half, perhaps. So some have a severe or moderate sleep apnea. So when you have sleep apnea, usually most cases is because of the tongue falling back and the airway closes. So jaw surgery has been shown that it's the best surgery or procedure for this sleep apnea with 80-85% success rate, which is one of the highest compared to any other procedure. So I do that a lot. I did that 2 days ago on a young patient, 40-year-old. And they tell me always a month later, they tell me it's amazing. For the first time, I've had a dream.
Because they were sleeping well enough to actually
Right, they never went to that deep stage of sleep to have a dream. So no more snoring, no more. They can now sleep with a partner. They don't sleep in the separate rooms.
What is the objective of that particular surgery? To make the jaw wider? What are you doing?
Right. So every case is different. And so orthodontic surgery, jaw surgery is like an art and medicine. So when I look at the patients that come for sleep apnea, I look at their airway, their bite, and aesthetics. So these three things I look at, and I don't forget about the other when I focus on one. So if you just focus on this, for example, airway, then you can really ruin the face. So I manipulate the upper jaw, lower jaw in my mind to see what would give the best face, best bite, and best airway for that patient. So after that, we plan it digitally and we perform the surgery. But so every case is different. The upper palate, the jaw might be narrow. We may have to widen it during the surgery. The lower jaw usually is back and small. We bring it forward along with the upper jaw and the chin. So with that, the profile becomes stronger and better too.
You mentioned gum grafting earlier.
Mm-hmm.
That's also life-changing, I think.
Yes.
Going from, I expect someone who can't smile because they're embarrassed to actually being able to open their mouth again.
Absolutely.
But is there a functional aspect to that too?
Absolutely, yep. I mean, now they can receive implants and have teeth and chew versus partial denture, removable denture. That's really annoying, especially on a young patient. Aesthetically, they can't smile at all. Now they can. And that's definitely functionally it matters, yes.
What are your very favorite kinds of cases?
Oh boy. Again, about oral maxillofacial surgery, I have many favorites. Orbital fractures and reconstruction used to be my favorites, and it still is probably. It's so much anatomy around the eye. Any jaw surgery is still my favorite. Chin surgery is my favorite. Trauma is my favorite because it really can help the patient getting back to their normal function.
What kind of trauma? So say I am in the ER for something
Hopefully
that just
not.
happened to me.
Yes.
Like I like to use the example that my toddler just headbutted me in the face and now my nose is broken. But what other kinds of situations would you want to have an OMS surgeon on speed dial for?
Anything from fractures, falls that can damage the frontal sinus in here, forehead. The eye socket can fracture. So when you look up, for example, one eye may go up and the other may get stuck because the fat and muscles have herniated to the sinus because of the fracture here. Nose fractures and jaw fractures. And also we do a lot of lacerations and cut repairs in the emergency room. Ear lacerations, dog bites, human bites. So I've seen it all.
Oh, no.
And gunshots, of course.
You did work in Queens.
In Brooklyn, yes.
In Brooklyn. Yeah.
Machetes into the face, seen it all. Gunshots, a lot of gunshots to the face, neck, and all those things. Can be busy during summer in emergency rooms.
I bet you've seen it all.
Yes, and infections too, severe infections from teeth going to the neck.
Let's switch gears a little bit. Tell me about what you do outside of work.
Oh, son with my boy. That takes
you have
all
a son?
All my time goes to him. I try. He's a 7-year-old, and just try to spend as much as possible because they grow fast, and I got only a few years before he stops talking to me and goes with his friends.
Boy, do I know how that,
Yes, teenage. So, we just try to play soccer with each other and take him out here and there. But that's about it, really. And then I go to sleep.
Has he been to Iran yet?
No, he would love to go, and he keeps telling me almost once a month. He just loves the culture and food and everything. So I try to educate him a little bit about it. And for example, when Iranian soccer team plays, he supports Iranian soccer team. I'm like, you don't even know. So it's funny, but it's a shame that I can't take him there because at this point, its situation is not very good. I don't even dare to go back. So
I hope that changes someday.
I hope so too. It's a beautiful country. So it's a lot of culture.
Is there anything you're looking forward to in the next year?
Good health and helping more patients with jaw surgeries and implants.
No surgeon works alone. Everyone has a team. Can you talk about your team a little bit?
Sure. I have a great team in the office, and in the operating room, I actually have been in Brooklyn Methodist Hospital, Presbyterian, and there are residents that are there that help out a lot. They're very good residents. And recently I started working in Mount Sinai West and Beth Israel Hospital, fabulous oral maxillofacial surgeons. They're dual degree, DMD and MD degree with a great director. And it's just such a great hospital and great staff. So it's just awesome
Are you teaching?
teamwork. I'm more learning from them, but here and there I say some nonsense stuff and they may learn. So I learn a lot from residents. So. And it's good to work with others because you pick up something from someone.
Yeah, that's what keeps us all going.
Yes.
Learning from others. What would you like listeners to take away from listening to this podcast today?
Oh, boy. I think I'm a dedicated surgeon and that I really care for the patients. Every jaw surgery that I do, they have my cell phone, and I'm one text away, 24 hours. I always say if I do surgery, I'm married to the patient. So I'm always available. So I just try to do my best and in an honest way. So might not be right for everyone, but hopefully for many people.
And I would volunteer just that understanding what OMS surgeons do is another thing that we could take away, because there's not that many of you, and it's a very unique specialty, and most of us don't run into it.
Correct.
Unless something's really wrong, right?
Right. Not too many people know about the OMFS, and I think it's really underrated specialty.
Yeah, but you're all the most chill, amazing personalities. Every single one that I meet is just kind of like you, actually.
Oh, okay.
A little bit bold and solid, really solid.
Yeah.
If someone wants to find out more about you and they're listening today, where should they look for you online?
I have an Instagram page and also my website at omsofny.com. So I try to put a lot of information in there, but they can find before and after pictures in real self. So a combination of stuff. And of course, they're welcome to come in for a consult.
And I'll link all of that in the show notes so it's easy to find.
Yes. Thank you very much.
Yeah. Thank you for joining us today.
Pleasure. Thank you very much.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.